Anchi, Pitakwe. Hello. Come in. Denise McQuaig de Shinnikashan. It's my pleasure to be invited today to speak to you about the Limichif Otipamisawak Life Promotion Protocol. Like anyone being invited to speak, I thought carefully about what I would wear and what I would say. So I've chosen a dress with flowers that symbolize my Métis heritage, known as the flower beadwork people, and in the quote from Christy Belcourt, being acknowledged as being much like wildflowers. We grow and are as resilient as a weed, but are as beautiful as well. I also chose from my collection of sashes the harm reduction sash today, created by the Métis Nation of British Columbia as a symbol of our commitment to reducing substance misuse, improving mental wellness, and decreasing the harms experienced by our Métis citizens. It is my pleasure to join you from the comfort of my backyard. I mean, what better place to be connected to land and to feel comfortable talking about such a challenging and difficult topic, that of suicide ideation and completed suicides. It is my pleasure to join you today from Te Kamloops to Secwepemc, or what is colonially known as Kamloops, British Columbia. I have the great pleasure of living, working, and playing within the heart of Secwepemc Ulu and the chosen home of the Two Rivers Métis Society. It is my pleasure to invite you to learn more about Lemichif Otipamisawak Child and Family Services Society, which I will, as I speak, refer to going forward as LMO. It has been my great pleasure for a number of years to be a member of the Elders Council of Lemichif Otipamisawak, and also a over 30-year career in healthcare and social services with a focus on mental health and addiction services. I come to this work passionate not only from my career and work experience, from my passion for supporting my nation, the Métis Nation, but also as someone with lived and living experience of mental health challenges and what that means to have supporting youth and our future ancestors. Lemichif Otipamisawak Child and Family Services, LMO, is a fully delegated child welfare agency residing in Kamloops, where we not only deliver supports such as foster care and kinship placements for our children and youth, but also preventative services, everything ranging from parenting supports to a child and youth mental health team, to youth care workers. And we're very proud to be exercising our right to govern and deliver services to our children, youth, and families. In 2019, as part of that vision for delivering appropriate services to our children and youth, LMO began to build Qikiqilk, a place of belonging, a 31-unit supportive housing complex where both youth aged 16 to 27 who had experienced child welfare and aged out, and elders could reside under one roof. It's been an incredible project supported by many governments and communities, supported by the Te Kamloops to Secwepemc Nation and community as well, in our vision to create a supportive environment where our young people could learn and grow into independence. It began as not just a project, but a place where our youth could participate, even beginning in the early stages as part of the construction crew. It didn't take long after we opened to realize the many challenges that our youth have experienced, both from the trauma from society and families who struggle with their wellness, but also the trauma of the child welfare system itself. And very early on, we came to realize that calling the RCMP, taking our youth to the local emergency department at our regional hospital, responding in the ways that historically had been identified, using suicide prevention tools, was just not going to be enough to support them to get through those challenging behaviors in times when their emotions were overwhelmed. There is a beautiful website called wisepractices.ca, developed by Dr. Jennifer White from the University of Victoria and a number of First Nations who are supporting youth across Turtle Island, where they begin to explore the idea of life promotion. We like to think of it not as just preventing death, but creating an environment where our young people can live and thrive. And so that takes us to the understanding of our life promotion protocol here at LMO. What will not be surprising to many of you who have chosen to watch this video is the reality of the impact of our traumas, both historical and in current day. They have created some of the most challenging statistics to think about here in Canada. For Métis citizens, we have a suicide rate 2 times that of the national average. For First Nations people of Canada, 3 times the national average. And for the Inuit, 9 times the national average. Much of the root cause has been understood as being grounded in our residential school experiences, our loss of land access, our loss of language, and our loss of recognition of being the original peoples of this land. And the impact of that is described beautifully in a story about Jacob, translated and put to paper by Métis author Maria Campbell in this incredible book called The Stories of the Road Allowance People. This story of Jacob became a tool in the training of staff at LMO when we implemented our life promotion protocol based on the input and the voices of not just youth and Métis and First Nations youth, but also our elders. I invite you now to sit down and get comfortable. This is going to be your opportunity to think about what you understand about self-injury and suicide within First Nations and Métis community, to think about how life promotion can be just as effective as the more historical suicide prevention tools, and to come with us on a journey of how we created the Reason for Living inventory with First Nations and Métis culture embedded, how we trained staff who support our youth during times of trauma and despair, and how we have taken the time to unpack our understanding of everything from the way in which the brain responds during crisis to our own biases on this topic that can be so traumatizing for us to think about. I pause now and I invite you to listen to Nicole Mercado, our clinical supervisor and the lead for Child and Youth Mental Health team at LMO, as she describes the development of the LMO Life Promotion Protocol and Assessment Tool. We know many of the root causes historically of suicide ideation and to the behaviors that lead to self-inflicted harm. One of these stories is the story of Jacob, captured in this beautiful book, Stories of the Road Allowance People, translated and put to paper by Métis author Maria Campbell.